Well, welcome to yet another amazing episode of Wellness Talks. Look, we are wrapping up this amazing series on reproductive wellness for women. And it has been when I say a tremendous time, you all have gotten to know my guest co-host, Daneshia Starling, as we have unpacked conversations around the reproductive wellness cycle. And what better way to in this amazing journey than by talking about something that many women suffer with, and that's fibroids. And when I think about fibroids, immediately my mind is drawn to my personal experience that I had with fibroids and, how I was able to overcome it, right? And no longer suffer from fibroids. And I lived at the time in Atlanta, Georgia. And of course, when you go to your OBGYN, the first thing they want to do is schedule you for surgery. And I was like, I'm not doing that, right? And so then you make a decision on whether or not you're just going to keep the fibroids and continue to suffer or what. And so because of my background in health and wellness and because of the amazing relationships I had in Atlanta, I was introduced to an amazing practitioner, and his name is Dr. John Lipman. Dr. John Lipman is a board-certified intervention radiologist and renowned authority in the non-surgical treatment of uterine fibroids. And I had this amazing procedure. Oh my God. And my life has not been the same. I'm telling you, when you think about the suffering that many women go through when they have fibroids, a lot of times you don't even realize that you're suffering because of the fibroids. And then all of a sudden they're gone and you feel amazing again. You get your energy levels back. And so we're going to talk through this with Dr. John Lipman today, as well as my guest co-host, Daneshia Starling. So Dr. Lipman received his master's and medical degrees from Georgetown University School of Medicine in 1985. He completed a residency in diagnostic radiology at Brigham and Women's Hospital, Harvard Medical School, and then he did a fellowship in vascular interventional radiology at Yale New Haven Hospital, Yale University School of Medicine. And I had to read that because he knows his stuff. Not only is he an amazing physician, changing the lives of so many women, he is a personal friend of mine who I've had the pleasure of walking and working alongside of with the Atlanta Black Chamber's Health and Wellness Committee. So I'm going to invite my friends to the stage, Daneshia Starling and Dr. John Lipman. How y'all doing?
Good evening, everyone. Hi,
Great to be
Dr.
with you.
Lipman. Same here.
So again, Dr. Lipman, thank you so much for joining us. This is going to be a fun conversation. You're on here with two
Absolutely.
chocolate girls. So we're going to have to, add some humor to it. But Dr. Lipman is used
Excellent.
to it. He's used to it.
And you're in Atlanta, so I'm
And I successfully defended my black card not long ago on Kiss 104 live.
Period.
Yes.
Yeah.
Yes.
I got all three right. 3 for 3, not just 2. I only needed 2, but I got all 3.
Listen, you are invited to the cookout, sir. You're
Period.
invited to the cookout.
I just want to know, do you like collard greens? That's all I want to know. Do you like collard
Oh,
greens?
I love collard greens. Love
That's all.
collard greens.
That's it. That's all we need to know.
And I'm very old school. In fact, we play 70s R&B when we're doing procedures. And I was telling Frank Ski, good friend of mine, that somebody called me old school. And Frank says, nah, Doctor, you ain't old school. You're old school.
Old school.
Like really old school, not just old.
So you're
really
OG.
old.
You're OG at this point.
Yeah.
Yes, he is an OG. And the amazing thing about him being an OG is he is now paying it forward and he's teaching the generations under him this amazing procedure so that he can continue to live on through the hands of other practitioners, not only in the United States, but abroad as well. So we're definitely going to lean into that conversation with him. But one question I want to ask my audience before we jump into this conversation is, did you know that millions of women are living with uterine fibroids and they don't even realize it? And for some women, it shows up as heavy periods. For other women, it shows up as pelvic pressure, fatigue,
Mhm.
fertility challenges, and symptoms that seem completely unrelated. Remember, I said I was so tired, fatigue, right? And so we really want to talk about some of those hidden things that women don't even
Absolutely.
realize. It is so, so, so important. So before we get into the clinical side of fibroids, Dr. L, I want you to open up our conversation with just telling us a little bit about who you are, because some people may not know who you are. We know who you are. We love you. But there may be people in other cities like Minnesota, where I live, that have no idea how awesome you are. So share your awesomeness with the people.
Well, I hope they know me in Minnesota. My brother was a state legislator for a number of years in Minnesota, but
Mm.
we see patients not only from all across the country, even other countries will come for our expertise. So we've seen patients from every continent except Antarctica. So if you're in Antarctica, consider coming to Atlanta Fibroid Center. But seriously, as you mentioned, fibroids are extremely common. 1 out of every 3 women have fibroids, and up to 80% of women of color have these benign tumors. So while they are benign, non-cancerous, which is great, as you mentioned, they can cause a lot of misery. It's the number one reason why women have heavy periods. And for some, they don't even realize what they're doing is heavy. And we can talk about that. What actually is heavy periods? Because I'll have patients say that they're bleeding normally, but they've been doing it for so long, they don't realize that their normal ain't normal. And so when you bleed heavily like that, you run a deficit. You can't possibly replace the iron and hemoglobin that you're losing in the blood. And hemoglobin carries our oxygen, and that's why you get fatigued. So you have this outpouring of blood, which leads to deficits of iron and hemoglobin. It's called anemia. And when the anemia gets pretty significant, you start feeling tired, weak, lethargic. You get headaches. You might faint or get dizzy, migraine-like headaches. You might chew ice. That's a common one. When I ask people if they chew or crave ice, they can't, but they're like thinking I'm clairvoyant. I'm looking right through them. How do you know that? And so sometimes they chew inedible things. Here in Georgia, they might chew Georgia white clay, kaolin, or cornstarch, or, so that's called pica. That comes with significant anemia. And then as you mentioned, there are other bulk related symptoms. So there's the bleeding symptoms, and then there are the bulk symptoms. These tumors are hard as rock, and they press on whatever's next to them. So if they're next to the lining, they cause the heavy periods. But if they're on the kind of lateral aspects, they press on the pelvic nerves to cause pain, pressure, bloating. If they're in the front of the uterus, they'll press on the bladder, compress the bladder like a paperweight on top of it. So the bladder can't fill to its capacity. So a woman has to urinate more frequently, wake up in the middle of the night to urinate. If it's in the back of the uterus, it'll press on the colon, causing constipation. Constipation is a commonly not recognized symptom of fibroids. They'll often they'll send it to the gastroenterologist. They won't find anything. It's fibroid related. Or sciatica is a common one, this pain that starts in the low back and the hip and buttock and shoots down a leg. They think, well, it's the same pain that you get when you throw your back out. But in these ladies, their backs are normal, and they can't figure out, why are they having sciatica? Well, it's because these big fibroids are pressing on the same pelvic nerves, just farther down the path. And fibroids are also the number one reason why women undergo hysterectomy. And that's really a shame, because if you take anything away from this podcast, whatever your gynecologist tells you, you don't have to do hysterectomy for fibroids. That is so important. Get that second opinion, because there's no one that has to have a hysterectomy for fibroids. There are better answers now. So no matter what they say, get that second opinion. But currently, fibroids are the number one reason why women get hysterectomy. The average age is less than 40, and I've met way too many women less than 30. I spoke at Tuskegee, and a number of women came up to me afterwards, less than 30 had already had hysterectomy. They were in tears because they heard my talk and couldn't believe they could have avoided major surgery, kept their uterus, even have children after, but instead, because they were suffering so badly, and when you're only given one choice, eventually some of these ladies say, okay, you win, I give up. I can't keep living like this. So despite the fact that these fibroids are benign, they're the number one reason why women get hysterectomy, and these are young women. So the question then becomes, why are physicians performing an amputation, because that's what hysterectomy is, in young Black women? We can talk about the whys, but it can get, as it did in Tuskegee. Imagine a white male physician. My talk was telling these several hundred young Black women that they're undergoing the Tuskegee experiment of their lifetime and they don't even realize it. It got real, believe me. In fact, I almost didn't give the talk because I was like, do I really want to do this? Do I really want to go there? And I talked to the woman who invited me, and she said, Doc, we invited you for a reason. It's not the messenger, it's the message. And it was fantastic. I mean, it was very well received. It was a great evening, but that's the issue. It's like, why are we doing this? It's got to stop.
That is so good. I just got a snap. That is so good. And thank you. Thank you for being honest. Thank you for being the amazing educator that you are. Thank you for performing an award-winning. Have you gotten a Nobel Peace Prize yet, Dr. Lipman?
No.
Okay, it's coming. It's coming. We're going to get you that Nobel Peace Prize. Thank you so much for helping so many women with this procedure, because that breaks my heart that women, because I work in maternal health, that women will not be able to have a baby because they were suffering so much that they were just told, let's just have a hysterectomy. Not to mention the 6 to 8 weeks of recovery and now the scar tissue. I mean, we could just go on and on about that procedure, right? But thank you.
And nobody really talks about what happens to a woman when they lose their uterus. I can't tell you how many people have told me.
Can we talk about it?
My gynecologist told me if I wasn't interested in children, that I don't need my uterus any longer. In fact, I have medical textbooks on my shelf. Now, I'm a fairly old gentleman, but even so, in my lifetime, I have medical textbooks that say the uterus is worthless after childbearing. Now, that kind of illogic has persisted. I hear it all the time in the office. My doctor told me I didn't need my uterus anymore because I'm not interested in children. That is absurd. It is absolutely absurd. The uterus has a lot of important functions for women besides bearing them children. It's important for them psychologically. There are a number of women that struggle psychologically, like a man being castrated after hysterectomy. There are a lot of women that struggle sexually. It can be embarrassing to talk about, but loss of libido, loss of orgasm, bone loss. There's significant bone loss after hysterectomy, and women are more active these days than previous generations. There's a lot of urinary leaking. If you don't believe me, next time you go into Kroger or Publix or wherever adult diapers are sold, see who's on the package. Who I think needs to be on the package is an elderly man or an elderly woman, someone in their 90s. You won't see that. You'll see someone in their 30s and a woman of color. Why? Because that's the target. It's not elderly people. It's women. As I say, the average age of hysterectomy is under 40. So these are young women of color are going to be on the package of an adult diaper because that's the target and they know it. And it's really sad.
It is really sad. And thank you for setting the record straight about that. And this is one of the reasons why every time someone tells me that they have fibroids, I'm like, you got to go to Dr. Lipman. You got to go to Atlanta Fibroid Center. I'm just like constantly sending people your way. And thank you for also sharing that not only is this procedure being done in Atlanta, can you also share what other states this procedure is being done, because you're training doctors on this procedure as well? Share that with us while we're right here in the halfway point.
This is available throughout the country, and this isn't anything new. It's new to a lot of people because their gynecologists have kept this information from them. This procedure, I've been performing this procedure in Atlanta for the past 30 years. So this isn't anything new. It's well proven safe and effective. Even the parent society, the American College of Obstetrics and Gynecologists, that's the parent organization of all OBGYNs throughout the country, endorsed UFE, the procedure that we do, back in 2008. So it's been 18 years since. It took them a long time. We started doing it in the mid-90s, but it took them till 2008 to finally give it the blessing with the highest level of medical evidence, level A. Very few things ever make it to level A, but UFE, uterine fibroid embolization, did, and they gave it the highest level of medical evidence for safety and efficacy for treating women with fibroids. But still, the vast majority of gynecologists do not mention it to their patients. They'll mention the surgical options, but women are entitled to know all the options and make the choice that's best for them. They're the CEO of their own body. Nobody knows their body better than them. But if you don't give them all the choices, how could they possibly make the choice that's best for them? And they know that. So they will, the majority of gynecologists only mention the surgery. If either you get the surgery, anything else, nope. Even though they all know about it. I mean, this is, say, all the gynecologists, it's not like they don't know it exists or no, they all know about it, but they choose not to tell somebody. Again, it's unconscionable. I don't know how these physicians sleep at night.
Yeah, they like the cut. That's what we say in maternal
Yeah, I mean, you
health.
went into gynecology to help women. I mean, really, I would presume that. Why else would you become a gynecologist? I have the UFE procedure, uterine fibroid embolization procedure, is really one of the biggest breakthroughs for women, particularly women of color who disproportionately suffer with fibroids. I'd put it up there in terms of significance to women in general, with the pap smear and the mammogram. It's that significant, and you don't mention it? I mean, my goodness.
Yeah. That's a Selah. See, when we have those kind of moments, that's when I just like to say Selah right there, for sure. Dr. Lipman, why did you get into this specific procedure? Is there an origin story on why you chose to go in this direction?
Nothing happens by accident. I met my wife because I applied to the wrong residency. I mean, this procedure, UFE, was discovered by accident. In fact, I could start with that story. It's probably more interesting than how I got into it. But we had been performing embolizations for cancerous tumors for a number of years. And so it was to make the surgery easier, because there's a number of cancerous tumors that are very vascular. And if you can cut the blood supply off to these tumors, it makes it an easier, quicker surgery, easier for the patient, easier for the surgeon, easier, less anesthetic time. And so when we do that, when we were doing it, the patient would undergo the embolization and then go right to surgery, and then it would be a quicker, easier surgery for the patient. So back in the early to mid 90s, there was a group in France that got the bright idea, why don't we do that for fibroids prior to hysterectomy? Fibroids, even though they're not cancerous, they're very vascular and they bleed a lot. And so why don't we have the interventional radiologists embolize them prior to doing the hysterectomy? It'll make it an easier, quicker hysterectomy. Okay, no one had ever done that before. So they started doing that in France. And unlike this country, in France, in Europe and Canada, the healthcare system is socialized. It's rationed healthcare, socialized medicine. Unless it was an emergency, you've got to wait for care. So these women would come in, they would get embolized, and then they were sent home and waited 6 weeks, 7 weeks, 8 weeks to get their elective hysterectomy. Well, what happened when these women were waiting 6, 7, 8 weeks? Their symptoms started going away. And so these women would call up the gynecologist and say, I feel great. My periods are light now. My pain's gone. I'm not urinating frequently. I'm sleeping through the night. All my symptoms that I was suffering with from these fibroids, they're gone. I feel great. Do I still need that hysterectomy? Because I don't have any symptoms anymore. And the answer was no. You didn't have to do the second part. All you needed was part one, the embolization. So the gynecologist that was overseeing this trial called one of his friends in the States. He was the chairman of OBGYN at UCLA at the time, and said, you better get the interventional radiologist to look at this. It's pretty interesting. So UCLA, the chief of interventional radiology at the time is a colleague, a friend of mine, Scott Goodwin. And Scott did the very first series of patients with this uterine fibroid embolization procedure. And he happened to be presenting this data at a conference that I was invited to present my data on cancerous tumors that I was embolizing. And I heard Scott's talk, and it's like the light bulb went off. I'm in Atlanta. This is something that could help a lot of women of color. And so I did the very first UFE here in the Southeast. And now I have amassed the largest So they say worldwide experience, well over 10,000 women I've treated.
That is so good. I love that. And I'm one of the 10,000. I'm one of the 10,000. We talked a little bit about this, but why do you think that fibroids are so often overlooked and misdiagnosed, right? Because you mentioned
Ugh,
about the heavy periods, right? And how that's normal. And, me and my co-host already talked about these heavy periods are not normal.
right.
So can you
They're
unpack
not
that for us?
normal.
They're not normal.
Physicians will ignore it. The patients don't realize sometimes just because they've been doing it for so long. They don't realize it's not normal. In fact, they may ask their mom, and their mom may say, well, we're just heavy bleeders. You just got to put up with it. The mom was a heavy bleeder and she had a hysterectomy for fibroids. Everyone in their family has had hysterectomies. It's almost like we expect this to happen, and you must either suffer or eventually get a hysterectomy. And there is a better way. UFE, as I say, is a much better way. It's a 30-minute procedure. The patient sleeps through it, but they're not put to sleep like surgery. The sedation's much nicer. It's IV and local. The approach is at the very top of the right leg, where the leg meets the torso. And we can negotiate a little tiny catheter, like a piece of spaghetti, under X-ray. I can go into each uterine artery one at a time. And each of those uterine arteries is like a tree. I'm in the big trunk, but then it starts to branch, and the branches get smaller and smaller and smaller till you get out to the leaves of the tree. The fibroids are the leaves of the tree, and I know what size those small peripheral branches are, and I can plug them up. The big trunk and the main branches stay open, but all the fibroids die without a blood supply. They die. Uterus, it stays alive, it's healthy, but all the fibroids are dead. As they die, they soften and shrink, and as the softening and shrinking go on, a woman's symptoms fade away. So with a 30-minute procedure where you go home literally with a Band-Aid, where we went in, if you were to look at what it looks like after we're done, it looks like the woman cut herself shaving. Like the little nick in the skin is covered by the pad of a regular Band-Aid. Recovery, usually about 5 or 6 days, but the next morning she's up and mobile, bed or couch that afternoon, evening, next morning, mobile. And so a very brief recovery. We tell patients plan on a week, but a lot of patients go back well before then versus 2 months or more with surgery.
I just want to first thank you because number one, I'm from Atlanta. I'm just amazed. I want to ask first of all, I almost want to call you like an abolitionist because the fact that you are bold enough to step into territory that is with the data that's out there with, especially minority and African American women, we do not have a lot of trust when it comes to our like other counterparts. You just don't. But it's very rare to see physicians of yourself to take that charge and take that lead. And it's also daunting to hear under 40. Like, I mean, I
Average.
was telling and I think in the previous podcast we were talking, I said, I'm starting to see now like African American college students like freezing their eggs for money. But to hear that they're getting like a whole hysterectomy is really daunting to me. And my first question is, do you think it's more like why do you think like minority women, especially African American women, are targeted? I suffer with extremely heavy cycles myself. And I had to, revert to wearing what I call the period pad, like Pampers, but they're not. But I wear a certain type. And I was just like, it really is just a lot of young African American women on there. And I'm like, what happened to the days of, like you said, incontinence, where it's like older adults wearing these? But it's not. So those are my first. So I want to start with those first two questions because it also made me think of Henrietta Lacks.
The first
Mhm.
is, if I'm hearing you correctly, is why is it women of color? Why are fibroids so common? It's common in all women, but it's particularly common in women of color. Why is that? Well, it's a number of reasons. Some of the things are things you can control or have some control over, and some of the things you can't or don't, at
Right.
least currently. So the thing you can't control is the genetic aspect. There is a genetic predisposition running in African American families. If your mom had fibroids, and the more relatives that you have in your family, particularly mom and maternal grandmother, you're
Mhm.
likely to suffer with fibroids. Okay, well, you can't pick your parents. You can't do anything about that. But there are a whole host of other things that you can do that will definitely make it easier, better, or less likely to suffer with fibroids. We don't know where fibroids come from. And we should really talk about that because that's a real health disparity that we should address at some point later. We don't know where fibroids come from, but once they arrive on the scene, they grow with estrogen, particularly, and progesterone too, but primarily estrogen. That's why they can grow rapidly during pregnancy and why they tend not to be an issue once a woman reaches menopause, although we will treat postmenopausal women for the bulk-related symptoms that they cause. But so they grow with estrogen. Well, estrogen is pervasive. It's in the food, it's in the water. You can't avoid it. But there are certain hormone-rich foods, red meat, non-organic chicken, dairy, and if you can try to limit those or do workarounds, it will make things better. If you can eat more colored fruits and vegetables have flavonoids in them. They're compounds that block a very important enzyme in estrogen production. So try to limit hormone-rich foods or eliminate if you can. Increase consumption of colored fruits and vegetables, and then try to lose excess body fat because body fat is a reservoir and producer of estrogen. Estrogen is produced and stored in body fat. And so we're not asking people to be skinny, but we'll talk to patients. Everybody knows their, kind of ideal weight number. Try to get to that number as best you can. Like, no one's saying you got to drop all sorts of weight or be skinny, but any excess body fat that you can drop is going to be helpful in your fibroid journey. And the last piece is vitamin D. Vitamin D is the most powerful growth inhibitor of fibroids that we know of. Green tea extract is pretty good, but vitamin D is better, much better. The problem is only 10% of African American men or women have adequate vitamin D. And the darker the pigment of your skin, the harder it is to get adequate vitamin D. And if you have a normal vitamin D, you are much less likely to suffer with fibroids. We recommend everybody get checked, and depending on how low the value is, you need to be supplemented to a certain degree. Some people can just take over-the-counter stuff. Some are so low they need a prescription. And so that would be important to get the testing and see your doctor about that. So that's kind of the reasons why African American women disproportionately suffer, because they tend to have more body fat than other racial groups. In fact, Asian women have the lowest body fat. They also have the lowest incidence of fibroids, but it's these other things too. It's the genetics. It's, all the estrogen stimulation, if you will, extra estrogen, whether it's through the water, whether it's through foods, whether it's through environmental things. But you can't pick your parents. You can't do the genetic thing, but you can do these other things. Exercise, eat healthy, try to be as close to your ideal body weight. Make sure your vitamin D is normal or get to normal, and that will help. So that's like question one. The other one is a little more challenging as far as you're talking about the racial aspects of the mistreatment of Black women, particularly in the South. We're in Atlanta. We have a very poor history of treating Black women when it comes to their reproductive organs. You can talk about, you mentioned Henrietta Lacks or Fannie Lou Hamer and the Mississippi appendectomies. And so, unfortunately, some of that still lingers to this day. And you mentioned, obviously being a white male physician in the South, I am extremely sensitive to the historical. And so one of the things that I think is, when people come to see us at the Atlanta Fibroid Center and meet me, maybe they've seen stuff online or they've seen podcasts and other things we've done like this, but they haven't met me in person. And I think once they come into the office for a consultation and meet me in person, I think they can understand trust begins, when they see, I really want to help. And there are people that after we talk and we go through all the different options and they choose surgery, or maybe I even recommend surgery. And for some women, the surgery may be the better choice, but I will lay out all the options and the patient will decide. And so I think that's the big difference. They see how much I care, and that's where trust begins. It doesn't matter if the color pigment of my skin. I am the least melanated member of an all Black physician organization. I do a lot of work with the Atlanta Black Chamber, as Chai can mention. So, I am commonly the only Caucasian in the room. I spoke in front of hundreds of AKA members. So it's okay. It's not about that. It's say once they know you care, trust comes from that. And I think they see that when they come into our center. We want to help women. We want to give them choices that they've never heard.
They've never heard.
Unfortunately, even though we've been doing this procedure for 30 years, most women never hear about it. We want to give them all the choices, let them decide. And if they choose surgery, God bless them. At least they know all the options. They choose what's best for them. And ultimately, that's what we all want.
Absolutely.
All we want is full disclosure. That's all
Full
we want.
disclosure.
That's all we
Yeah.
want is full disclosure. You know, when a woman senses that something's not quite right with their cycle and they're having symptoms, what questions should they ask their doctor? If they're going to see their OBGYN, I want to know
Well,
how we can empower them.
it's really important when someone is, say, you're the CEO of your own body. Nobody knows your body better than you. And when something doesn't seem right or doesn't feel right, get it checked. Absolutely get it checked and bring somebody with you so that it's important to bring a friend or somebody if they can, just because sometimes, you don't hear things right. Did I hear that correctly? And you have somebody with you to kind of, maybe they take notes so that, you get the information. There's an example outside of fibroids. We tell women it's important for women to examine their breasts because, a physician will examine their breasts if it's a breast surgeon or a breast expert, but it's only, a one-time encounter or maybe it's a yearly encounter. They don't, but a woman who should examine their breasts every day and know if something is out of whack, you direct the physician to that particular area, because if you don't really know, is this something new or different if you don't regularly examine yourself. So if something doesn't feel right, take that concern to your doctor. And if after that encounter with the doctor, if you feel like you're being dismissed or not listened to, or they're not taking what you're saying seriously, find another doctor. There are plenty of excellent doctors wherever you are, whether it's Atlanta or elsewhere. Find another physician. Don't say, oh, well, dismiss it.
Right.
It's alerting you for some reason. Chase it down and get your questions answered.
What is considered, like when we first started this conversation, you were saying is not normal. So what's considered normal and what's considered heavy bleeding?
Well, the definition of heavy period is kind of a inexact science, but some places will say if you have 50 cc's of blood a month, it's abnormal, or some will say 80 cc's is definitely too much. But then a woman will say, well, 80 cc's, how much is that? Or if you'll say it's about, 5 or 6 tablespoons, but nobody is like measuring volume like that. It's in a pad. How do you know? First of all, there's all sorts of definitions of what's too heavy in textbooks, but it's not practical at all. No one is taking Depends or pads and squeezing them and measuring out the volume. So I tell patients, don't worry what your hemoglobin is. Don't worry, it's, first of all, if your period is heavy enough that it's interfering with your quality of life in any way, that ain't normal, period, end. But if you have to change a pad more frequently than every 3 or 4 hours, if you are having to use more than one pad at a time, those things are abnormal. If you see, you're allowed to have little tiny clots, but if your clots are quarter size or bigger, I mean, some women come in and say, oh yeah, the clot is as big as my hand or my palm or my fist. I mean, that ain't normal. So no matter how long you've been doing that, if you can't go over to your girlfriend's couch, or if you can't sleep on good linens, or if you're afraid that you're going to bleed through at any point, none of that is normal. None of that is normal. So, it's really qualitative. If you're afraid to do any activity because of your period, it's not normal. Your period shouldn't run your life. And a lot of the patients that come in to see us at the Atlanta Fibroid Center, everything they do or don't do revolves around this horrific period. And because they've been doing it for so long, it's like, well, that's my lot in life. I went to the doctor. They said my hemoglobin was normal or close to normal. They really didn't recommend anything for it. And I just this is my lot in life. Or I'm getting older. I'm 40 now. I expect to kind of have to do No, none of this is normal. You can get your life back. Has transformed thousands and thousands of lives with a very simple outpatient procedure where you get the relief of symptoms, you avoid the risks and long recovery of surgery, and importantly, and often underappreciated, you get to keep all your parts.
That's so good. That's so good. This makes me happy.
It is.
This makes me so happy. So I'm thinking about an instance when I had a mother who was pregnant with twins. And she said, Miss Chai, she was suffering. Also have fibroids. So here in her belly, she's trying to nurture and grow these babies, but she's also fighting against these fibroids that were keeping her in and out of the hospital. And at that point, I'm like lost for words. Like, I'm like, I know we can't do it. Like, I called Dr. Lipman, y'all. I was like, can you do a procedure? I'm pregnant with him. And he was like, Chai, no.
No.
Because I felt so bad for her. But I told her, as soon as you have these babies, please schedule an appointment. And she promised that she would. She was in Atlanta. But what recommendations would you give a woman who maybe she didn't know she had fibroids and now she's pregnant and she finds out that she has fibroids? Is there any recommendation that you can give her, to have this healthy pregnancy? Because many of them really do suffer when they're pregnant.
Yeah, fibroids can interfere with any part of the fertility journey from fertilization all the way to delivery. Every part of that path, fibroids can interfere with it and interfere and prevent it from going on to the next step. However, most women with fibroids will have uneventful pregnancies. So while they can interfere, for most, they won't interfere such that it will prevent them from being successful and having a child. Now, it may cause them to come into the hospital sooner. Maybe they're monitored more closely, but the end result is still a positive pregnancy outcome. But they will grow because, as we mentioned earlier, fibroids grow with estrogen, and the surge of estrogen during pregnancy will make these fibroids grow. And particularly when you've got twins, that's really going to be challenging. But unfortunately, because we do the UFE procedure under X-ray, and it's not very much, it's a small amount, but we can't treat anyone that's pregnant. I guess the best prevention is knowing about having fibroids, and that would be usually with an ultrasound with the gynecologist. So as soon as they're pregnant, oftentimes patients will get an ultrasound early in the pregnancy to confirm that they are pregnant, it's a viable pregnancy. And at that time, they should remark on the presence of fibroids and whether or not, depending on the size and more importantly, the location of these fibroids, will often determine whether or not the pregnancy will likely be successful. But in general, most women, even with fibroids, have successful pregnancy outcomes.
Yeah, I noticed that they do suffer from anemia more often too. That's one of the main symptoms that I see, that they're anemic and they have to take iron pills, which that leads to some other things too. But that's one of the things that they typically suffer with a lot is the anemia. Daneshia, do you have any more questions?
I actually have two. So my first question is, how important is it for women to really know their history, their history of fibroids, or just like in this instance when it comes to preconception health? And then how common is it for fibroids to really impact infertility?
Well, infertility is defined as not being able to become pregnant with unprotected intercourse for 1 year. So if a woman has gone 1 year unprotected and is trying to get pregnant and not able to, then that is the definition of infertility. And that usually elicits a pretty significant workup with a reproductive endocrinologist, a specialized OBGYN in fertility. When you hear of a fertility doctor, that they're reproductive endocrinologists. And there's a whole workup, and there's a male aspect to the workup with a urologist to look at sperm counts and sperm motility and all sorts of male factor. But then there's also a female evaluation. They'll often get what's called an HSG to evaluate the uterine cavity to see if the tubes are patent and that sort of thing. If you have a background in your family, that's going to be important to know about. Talking to your mom, if you have sisters, aunties, knowing your family's background, particularly with fibroids, because as we mentioned earlier, you're more likely to have them and suffer with them if you have other family members that did. And then if you become pregnant, making sure that you talk to your gynecologist about it, and making sure, depending on your family history, whether and the size of the fibroids, if a high-risk OB is necessary. There are some OBGYNs that specialize in kind of these higher risk pregnancies. One of the issues with the mortality rates of maternal health is so high, particularly in the South and Georgia, is that women are not getting the appropriate prenatal care. There's nothing worse for a woman and her fetus to kind of present in like either like preterm labor or late in pregnancy, and she's horribly diabetic with her glucose out of control. She's got hypertension. She's not on any medications. It's poorly controlled. So it's kind of a medical disaster in this woman. And oh, by the way, she's pregnant and pretty far along. That's a recipe for a disaster for mom, for the baby, or both. And that's why early prenatal care is so important. The woman should try to get in her best shape so that she will have a successful, hopefully uneventful pregnancy. But if she's kind of out of whack medically, whether it's high blood pressure, diabetes, both, obesity, I mean, that's just a recipe for disaster, particularly when it presents to the doorstep later on, which unfortunately happens all too often here in Georgia.
What are some common blood tests that women can go to their doctor to start advocating for themselves?
Well, I think, making sure you make all the appointments necessary. You should see a gynecologist every year. That's really important. Getting not only the physical exam, pelvic exam, physical exam by the gynecologist, but also, there are some routine blood work. Occasionally, ultrasound is used, particularly if the woman is having symptoms related to fibroids. She may be suffering with heavy periods or pain. They will often do an office ultrasound because the physical exam, these tumors are hard and firm. They're like rocks. And so they can be felt on physical exam, but they want to confirm it. And every gynecologist has an ultrasound in their office. And so what they feel on physical exam, they might hear the patient telling them about their symptoms, but they want to confirm it. And the confirmatory study is getting an office ultrasound, pelvic ultrasound. Some of the blood tests, the hemoglobin we talked about, it's called an H&H, hemoglobin and hematocrit. That's a level that is often drawn to see if somebody's bleeding too much. If they're running a deficit of iron and hemoglobin, might show up in the hemoglobin and hematocrit. Sometimes if the bleeding is really significant, they might draw other levels like an actual iron level. You can measure the iron level in the blood. Ferritin is a common thing that's evaluated for women that are bleeding. And then they'll often do electrolytes just to make sure that your electrolytes are in balance. Some of these things can be out of whack. One of the things that we want to measure renal function because the contrast that we use can have an effect on the functioning kidney. We want to make sure because some of these women can have renal impairment they're not even aware of because with high blood pressure can come impairment of your kidneys. And there's really no way for a woman to know that unless she's got these blood tests. So we'll measure the renal function in these women. And sometimes we're the first to diagnose them being hypertensive. We're the first to diagnose that they have some impairment to their kidneys, which is important to know about. So, some of the routine blood tests, are important, and you should try to stay in check, not only get checked regularly, yearly with your gynecologist, but also there's things to do depending on your age. There's going to be importance for pap smears. Now, it used to be every year. Sometimes now they're stretching it out. If you have normal paps every year for a certain number of years, they will extend it out every year, but sometimes they'll measure it every 3 years. There's other routine screens. We talked about mammograms earlier and mammography. Getting, again, based on your age, getting the appropriate screening mammogram is important. And then colonoscopy, getting screening colonoscopy, and then every 5 years, if it's normal, making sure that you follow the guidelines to get the appropriate screens is important too.
That's so good and so helpful, and a great way to really conclude this conversation. Dr. Lipman, thank you so much for sharing your expertise with us today. I know so many women are going to be impacted by this conversation. Conversations like this are incredibly important because so many women are really navigating symptoms without realizing that answers and solutions exist. And because it's such a hush-hush conversation, we kind of unpack that with starting your very first menstrual cycle. I remember even my youngest daughter, when I would have conversations where she would be so bashful and so ashamed. I'm like, you can talk to me about this. And so some women are very, very private when it comes to this conversation, but I am
Right.
hopeful that when they hear this conversation, we have covered a plethora of topics in this one conversation. And one of the reasons I wanted to have it is because I know firsthand how impactful this treatment can be. As I mentioned at the very beginning, I was suffering with extreme fatigue, heavy periods, right? Extreme cramping. A lot of women cramp, and it's debilitating. And I'm just like, I don't, you all need to check that. You need to, really look into that. And because I have experienced this procedure for myself, I can vouch for it. Please take your vitamin D supplements. Please take your vitamin D supplements. Please take your vitamin D supplements. I have to say that all the time because your body is overcompensating, right? And you think it's normal because you've learned to function this way, but it ain't normal. You heard it from the man himself. It ain't normal. Okay.
It's not.
But having access to information and options is so, so, so very important. So we always love for our guests to close us out with one final statement. So if there's one message you could leave women with who are listening today about fibroids and reproductive health, what would it be?
Well, the one message is if your gynecologist tells you that you have to have a hysterectomy because you're suffering with fibroids, get a second opinion from an interventional radiologist like myself that performs this transformative, remarkable, safe, effective, non-surgical outpatient procedure called uterine fibroid embolization, or UFE, because you don't have to have a hysterectomy. Nobody has to have a hysterectomy if they're suffering with fibroids. There is a much better way. It's safer, it's less invasive, the recovery is much shorter, you get the relief of symptoms, and you get to keep all your parts, even have children if you want. It's covered by all insurance. That's not an issue. It's available throughout the country, in any of the major cities and even some of the less major cities throughout the United States. It's available. And so don't just accept something that you don't want or don't need. You don't have to have hysterectomy suffering with fibroids. UFE is a much, much better way.
I agree. I concur. Well, first and foremost, I want to say thank you to Daneshia Starling for co-hosting this Whole-Woman Reproductive Wellness Series with me this month for Women's History Month. I want to say thank you again to you, Dr. Lipman, for just hopping in there and being available. You are so awesome.
Well, I appreciate that very much. And people, if there are people out there that want to know, well, how do I get more information on this? How can I find you? Our
Yes.
website is loaded with information. It's ATLII.com. It stands for Atlanta Interventional Institute, which is the parent company of Atlanta Fibroid Center. So ATLII.com, the website, lots of information. Our Instagram is also very visual. That's DR, like doctor, DR underscore my last name. So it's DR underscore LIPMAN. Please follow me there. And then sometimes people will say, well, is there a way I can watch you do this procedure? And we do have people come and actually come in person. We see a lot of people from Morehouse School of Medicine, which
Yep.
I have a strong connection with Morehouse. We'll see it, faculty, residents. In fact, tomorrow, one of their medical students is coming to watch me do UFEs. But just if they want to be at home and watch it, they can go to our YouTube channel. So on our YouTube channel, which is Atlanta Fibroid Center, they go to YouTube and they can subscribe. It's free. There's no charge or anything. But if you go on our Atlanta Fibroid Center YouTube page, there's hundreds of videos on the page. But one of the more popular ones is something like Watch Dr. L do a UFE. They can watch the whole procedure. As I say, it's a 30-minute procedure, but I think the video is like 35 or 36 minutes because I'm talking as I'm doing it. And it's not gory because it's not surgery. It's very simple easy to watch, and it's not gross like pimple popper or anything like that. It's very easy to watch, simple, and step by step. You see exactly each and every step, very simple. And people like to see that. They're like, Doc, you told us how easy it was, but can I see it? Well, there you go. You can see it on YouTube.
And of course, all of the links are in the show notes. You know, we got to put the links in the show notes. And so Please be sure to subscribe. Be sure to share this episode with everybody that you know. And be sure to go back to part 1. This is part 4 of an amazing series, Whole-Woman Reproductive Wellness. We salute all of the women out there for an amazing Women's History Month. And we say take care of you because your family needs you. And we thank you again so much for watching and for joining us for this amazing Wellness Talk series. We'll see you soon.
Thank you.